Thank you, Mr Deputy Speaker. The Morrison government always has a view to the future. Whenever there is an opportunity, no matter how small, to make an efficiency gain and improve the lives of hard-working, everyday Australians, we take it. This legislation exemplifies this in a very small way. It removes a minor but impractical administrative measure that burdens medical practitioners and ultimately their patients. Mr Deputy Speaker, this is in line with the Morrison government's commitment to delivering an even better post-COVID-19 healthcare system. We should be ambitious for our healthcare system. That is why I served on the board of Cabrini Hospital before coming to this place, the only hospital in Higgins, a not-for-profit, Catholic-based private hospital. As I said in my first speech, our healthcare system is undoubtedly one of the best, if not the best in the world. It is a unique and effective blend of public and private, where the private sector provides innovation and choice, and the public sector provides a safety net for all. Mr Deputy Speaker, this bill simplifies the administrative processes for recognition of specialist and consultant physicians for Medicare purposes under the Health Insurance Act 1973. And I note the member for Macarthur in the chamber here today. I know he'll welcome this small addition to the changes we're rolling out. It will remove the requirement to pay a $30 prescribed fee for specialist and consultant physicians for Medicare purposes. This benefits practitioners and also Services Australia, who are tasked with processing this fee. Ultimately, it helps patients. Mr Deputy Speaker, currently the pathway to be recognised as a specialist or consultant physician requires a medical practitioner to apply to Services Australia for access to higher Medicare rebates. This process requires a medical practitioner to pay a prescribed fee of $30 via cheque or money order to have their application processed. The issue with this payment is that it is fundamentally outdated, an issue heightened by the COVID-19 pandemic. Movement restrictions and in-person services closures meant that practitioners had trouble paying the fee, while Services Australia had trouble processing the fee. As a result, patients missed out on receiving higher Medicare rebates. The cost of requiring a new modern system to take digital payments, and it is pretty hard to believe that we're talking about this in the 21st century, is far in excess of the $200,000 in revenue this payment generates over 4 years. Put simply, Mr Deputy Speaker, this is a prime example of red tape. It does not contribute significantly to government revenue, it doesn't help doctors, and with the COVID-19 pandemic is now unfairly hurting the hip pocket of patients. This bill corrects this issue. Mr Deputy Speaker, this small but important tweak is just one of the Morrison government's efforts to ensure a modern and efficient healthcare system post-COVID-19. The impact of COVID-19 means we've been required to become more sophisticated and flexible in the use of technology and to think differently about how to solve problems that face everyday Australians. For the short term, we'll have to continue to be agile and creative. And I welcome the fact that Australia has been very good at pivoting across many different aspects, including our healthcare sector. And one of the great developments coming out of the COVID-19 pandemic, one of the great pivots of 2020, in my view, has been the rapid expansion of telehealth services. And I welcome the comments by the member for Hindmarsh, but in fact I have a point of difference with him about the rollout of telehealth services. The uptake of new technology has been challenging for the best of us. However, as they so often do, our medical and health practitioners have taken this in their stride. They should be congratulated for their adaptability and responsiveness. Due to the programme's success in telehealth medicine and in the interests of safety and protecting both our doctors and our patients, this has now been extended to June 30th, 2021. The government has consulted extensively with peak bodies and members of the medical and health profession to ensure the staged and proportionate integration of healthcare services. Now, last year on November the 27th, the Minister for Health, Greg Hunt, flagged that telehealth in the long term will become a permanent addition to Australia's Medicare system. I look forward to this commitment being secured. And I congratulate the Minister for Health, Greg Hunt, on the excellent work that he has done in initiating a very rapid rollout of something that could have taken 10 years in a normal period of time, effectively to be rolled out in 10 weeks. And I do understand that he's working very hard with the sector to make sure that the rollout goes smoothly and that it is sustainable in the long term. But certainly, with 3.3 million video consultations and 41 million phone consultations provided last year. It's clear patients and medical practitioners alike have taken up telehealth with enthusiasm. While telehealth will never replace the more attentive and important care given in-person consultation, it fills a key gap in our health system. Whether you're travelling hundreds of kilometres, if not thousands of kilometres across this wide continent to see your medical practitioner, in particular your specialist, or whether you're sitting for literally hours in congested traffic in our major inner cities, telehealth provides a more efficient and rapid way for patients to connect with their doctors. And we do know that this will improve the effectiveness, particularly for me as a paediatrician. I know that parents having to take time off work in order to take their child to an appointment, to sit for hours in a medical practitioner's rooms, and yes, I would say I was responsible for some of that sitting, even though you do try to be effective and efficient as a medical practitioner, sometimes the wait can be long. But that being said, telehealth provides a more efficiency for people to be able to care for themselves, for their families, and to be able to do this in an efficient and effective way. I do think it's important, however, that we really do focus on telehealth utilising video technology. And at the moment, telehealth is predominantly phone-based, with 80% of services being provided by the phone. And this is where my views differ from the member for Hindmarsh, in that I think that percent should be 80% video health. And the reason for that is we know that many queues come from a video experience. And by not allowing that to be the most important aspect of the telehealth services, it means medical practitioners are potentially missing out on some important cues that they may receive via video conference. Now, I do understand that older Australians may not be as technology savvy as some might believe, but I actually think that older Australians have been enthusiastic with their uptake of things like telehealth, because once they have seen the light, so to speak, with regards to video health, I do believe they enthusiastically embrace it. Now, we do need to make sure that this is transitioned carefully and that there is support to ensuring that the video health links are secure and safe, and that privacy is also maintained. But I do believe these things can be addressed and certainly should be addressed. Access to bulk billed appointments via phone or video don't just benefit Australians in accessing their regular appointments in a pandemic, but they also help ensure that people who perhaps have depression or are unwell, who do not wish or cannot wish to leave their homes, particularly in cold winter months in Melbourne, are more likely to access healthcare. And that is very important with early intervention, and is very important for secondary prevention when people have been home from hospital to prevent readmissions. Too often, Australians, particularly living with chronic health disease or with disabilities, and especially those with fluctuating conditions, will face delays in accessing healthcare, and that can potentially compound their conditions. I would say that during COVID, one of the reasons the telehealth facilities were rolled out was to protect health practitioners during the epidemic or pandemic as well. It meant that we were able to, in that swift and crisis that we all faced, ensure that those, when we were facing difficulties with PPE and mask acquisition, that we could keep our frontline workers as safe as possible. So the use of telehealth had myriad of uses throughout the COVID pandemic. The use of telehealth is about protecting the most vulnerable members of our healthcare network. It is jointly about guaranteeing that vulnerable patients can receive continuity of care and advice. The expanded use of telehealth will undoubtedly be a positive legacy piece of the COVID-19 pandemic, and one that all Australians should feel proud of. Mr Deputy Speaker, the government is also implementing the most significant reforms to private health insurance in over a decade, which is making private health insurance simpler and more affordable. From the 1st of April 2021, the government increased the maximum age of dependence for private health insurance policies from 24 to 31 years and removed the age limit for dependents with a disability. I cannot emphasise how important this will be to ensuring that young people, maintain their private health cover, particularly if they've been part of their family's private health cover. This is part of the government's commitment to ensuring private health insurance is both affordable and provides value for money for consumers. This serves the additional purpose of encouraging young Australians to continue with private health insurance when they reach the age of 31, the age at which lifetime health cover commences. Now, my son is an example of this. He was on our family cover. He's a young man who has epilepsy, and unbeknownst to us, he allowed his private health insurance to lapse. During that period of time, he was trying to access a neurological appointment and took a long time to receive an appointment, and in the meantime was on the wrong dose of his anti-epileptic medication. He suffered a seizure, a generalised convulsion, which can be quite dangerous. So because he had allowed his PHI to lapse, he actually put his own health and life at risk. I'm delighted to say that he will now be able to be incorporated into our family health cover, and hopefully, as a young man who's only just commenced employment in the workforce, he may see the benefits of private health insurance for him going forward. And this gap between 24 and 31 years of age is often the time that young people are going out into the workforce. They have a lot of additional expenses. They're saving, hopefully, for their first home, as the member for Goldstein would be very pleased to hear. And they also, of course, have difficulties with job security. So PHI, or private health insurance, is often not their number one expense. So I think this extension is a very welcome extension. I think will benefit ensuring that people who wish or choose to invest in private health insurance will continue that coverage from their family coverage onwards. Mr Deputy Speaker, the Morrison government has worked hard to ensure the vitality of our healthcare system before, during and now after the COVID pandemic, although I note we're still not out of the woods yet. This minor but worthwhile amendment to prescribed fees is a welcome change, which will abolish this administrative imposition on medical practitioners. This is great news for our healthcare system and its practitioners, and ultimately for patients. I commend this bill to the House. Thank you, Mr Deputy Speaker.